Fambule Munado, Mina Dr. Matia, alias Musidoc JM. I want come with one special topic to Una today. We get small thing for do with child health and how it will affect the pikin when it don't go and become an adult. As we all know, say this week we pass on at the week of breastfeeding, and waiting at the talk about to get some relationship for do with breastfeeding. So this particular topic here, now attachment. Waiting are attachments in literal terms. We say two things they attach. Now that the two things they did together, they join, right? So if for example you go apply for a job, you take then application form, you go fill that form there, done, and then we'll ask you, say, please attach a copy of your passport picture. So when you don't fill the form, they take passport picture, you put it at the corner outside and say, you attach them. Then you clip them. When you don't clip them, the picture and that paper, then they intact, then they connect, then they become connected, right? So that nine are attachment. So when we talk about attachment in the sense of mortal man now, we talk about that strong emotional connection or bond what happen between the pikin and in primary caregiver. The primary caregiver can be in mama, in papa, in granny, or any other person where they provide the basic needs of the pikin them, especially where they between the ages of 1 and 3 to 5 years, right? So how this attachment they develop now when the primary caregiver they become sensitive and they give timely response to the pikin in behavioral cues them. For example, if the pikin want to drink water, he go cry. Then you need to understand say now water you want to drink, then you go get. If the pikin want eat, it gets something where they do where the primary caregiver go understand. Then you go able to respond to the need of that pikin. So this thing are very important, especially between the ages of 1 to 3, because it make the pikin develop that ability for able separate from impairing them later in life, for make it get autonomy, for take decision on own, and also for make a belief in trust and value relationships in later life. Yeah. So now we get what we call the hypothalamus pituitary adrenal axis. We involve the hypothalamus within the brain, pituitary gland within the brain, and the adrenal gland we sit down on top the kidneys inside we belly. So an interaction, chemical interaction, they take place between them three things them they throughout our life. So for make you get a matured hypothalamus pituitary adrenal axis, we will help you for navigate the stresses of life and the changes where life they present later. You actually need forget that attachment they adequately when you small and when you young, right? So now if you not able to get that attachment, it develop plenty disorder them now your life later. Yeah. And person will get that attachment fully, we say you get a secure attachment in childhood. Person will not able to get that attention there, we say you get an insecure attachment. So if you get secure attachment, which means you been get all the care them way you been supposed to forget at that age there, right? So if you're not able to get secure attachments, which means you either get some or you not get any. And if you develop secure attachment, it can either be the avoidant type, the anxious type, the ambivalent type, or the disorganized type. So the one that the avoidant type, person will get in look mild small. This person here will get avoidant attachment, insecure avoidant attachment. This person here, they actually not they get much value for relationships, right? They actually get self-worth, but they need to value relationships. So then kind people them, whether they get relationship later in life or not, it need to really bother them, right? So the other type we get now the ambivalent type. The ambivalent type, Then people there, yeah, then they actually form relationships, but they value them security far above the relationship. So, for example, if person they in relationship with person, then it can get problem. Then you call that person there. Then the person will get ambivalent attachment, ambivalent insecure attachment. That person they go tell you say, ah, if of course you go walk am out first na in mind. If I go na that place there, this person get police case. What if they go catch me? They say now all because I sabi and myself dey inside the problem. So you know, you go rather find the excuse not for go, or you send another person for make you go assist you, or probably you go send money or make you sort yourself out. But instead self not go with it because you value insecurity more as compared to the relationship. The other example can be net don't come, you don't miss person so much, then you want see him, then you call him, say, "Bro, come meet me." So. And the person talks say, "Ah, I think and I mind say if I come on now, let's say 9, 10, I come on now, I go to that place. What if them go attack me, then kill me?" They go say, "No, I know they go." Yeah, because it value insecurity beyond. Whereas the other person will get normal attachment, will actually take the risk because you don't miss that person, you want go. You can take the risk for good, and even the idea of hey, them go attack me now, you need to cross in mind. If it happen now, it will happen anyway. It will be an experience, but it not will be a deterrent for making go. So then kind of thing will happen. Then we get the other one, when the anxious type. So the anxious type, these people then they actually form relationship, but then they say the relationship not reliable, right? And then get another attributes in terms of the decision making, where them then for make them do anything, person actually get for approve, say, or then person get for appraise them, say you were able to do them. Yeah, they get for reassure them, say you go able to do them before they do them. So then kind of people they can get ideas, they can get innovations, but it is sit down at the mind. They need able initiate any action until person say, you go able to do them. Why you get all this talent, you get this, you need to do them. Somebody need for push them for make them able to do them. Otherwise they're not good one. So then kind of people then can usually form what we call strategies them for make them become attracted to other people. So the last type and the disorganized type. The disorganized type, then why they not get volition, they need to form relationships, they not trust any relationship, then self-esteem is down, right? So these are the types what we get. So you go find out say if person gets one or more of them insecure attachment, then they later in life you could develop a host of problems. It can be personality disorders, it can be problem with forming long-lasting relationships, it can be depression, right? So most in the way you see people then they become anxious over things and they become depressed over small issues where other people that can go to. You understand? Then they all stem from them small thing they won't able to acquire, that care won't able to acquire when we small. Okay. So one thing I want to talk about now is special type of disorganized insecure attachment, what we call reactive attachment disorder. Then kind of people then are the severest end of the spectrum of insecure attachment. So them now people then will experience traumatic events in their life where they're small. For example, the parents them the feds or them being get like serious injuries when they're small, right? Or the one that we face what we call abuse, child abuse, right? The one that we face neglect. Abuse can be in the form of sexual or physical, right? Or otherwise. The one that we face severe neglect. The parent that neglects them, the neighbor respond to their needs. The one that can come with reactive attachment disorder. And that disorder they make them get anger problems, right? Then get aggression, and they're not able to form any relationship with stable and their life. So they need to trust nobody. Then are the people that will go to jump from relationship to another. They will give comments like all men are like this. For example, excuse me for the language. Some we don't hear it, people then say all men are dogs, and then go take that addict, they then cling to them so strong that no man no go can of their life. then go feel really secure and comfortable. They always think about the negative aspect of life, and then they develop a host of other problems as they go in life. So in later episodes, I will come tell you how we will be able to manage the kind of problem them. Yeah, they actually amenable to treatments. Yeah, so currently now the Sierra Leone Psychiatric Teaching Hospital will get a clinical psychologist and will get seasoned medical personnel and they who will help you for make you navigate through. Even if you're not adults, we get this kind of experience them, but you don't know who side them come up. Then go take history from you and then deep into your childhood experiences them. And probably then they go unveil why you they experience some of them things in adults life. So I tell you now, plenty, thank you.